Welcome everyone to our town hall meeting powered by the Center for Closing the Health Gap. Very big shout out to our Cincinnati Vice Mayor Jan-Michele and Kearney. And I am your moderator tonight as well. I'm Tropikana from 101.1 The Wiz. Tonight we're going to talk about what our Black nurses need you to know, and we have an outstanding panel. First, I'd like to thank our tech team, John and Durant, and remind you that we are taping this session so that we can repost it for later. So please make sure that you share all that you want to share tonight so that others can join into the conversation later at their own leisure. For those of you who are listening to this live taping, you'll have a chance to get your questions answered. So if you're on Zoom or Facebook, go right ahead and start entering your questions now. And as the speakers are speaking, let's meet our panelists. All of tonight's panelists have degrees in nursing and are well-respected experts in their nursing field. Would each of you please tell us a little bit about yourself, your background in the nursing field, and what you're doing now? Let's start with Dr. Karen Bankston, previous director of Drake Hospital and former head of UC's nursing program.
Good evening, and thank you for the invitation. I'm very excited about this conversation. I think it's one that will serve not only our overall community well, but also the nurses themselves, because perhaps we'll be able to establish a safe place for them. I'm the senior in the group. I graduated from nursing school with an associate degree as an RN in 1976. So it's been 48 years for me. Started out practicing ER trauma nurse and moved into management relatively early in my career. I was probably 27 or 28, something like that. So I did nursing management for several years. Then I went into nursing administration. I was blessed to have gotten recruited to Cincinnati because I'm from Youngstown. Recruited to Cincinnati, and I was an administrator at the University of Cincinnati Medical Center, leaving there as chief operating officer right at the turn of the century. I then went on and did government relations work for what was then the Health Alliance. Some of you all will be familiar with that. Then I became CEO and senior vice president for the Drake Center, a job I held for about 6 years, retired, and then joined the University of Cincinnati College of Nursing as associate dean. I have a PhD in organizational behavior and development, always very interested in the relationships that individuals have. Held that job for 8 years and retired again. And now I kind of do this and hang out with these young ladies. They allow me to do that. But for me, and we'll certainly talk more about it, for me, the sadness about having to have this discussion is that many of the things that I know that we'll probably talk about today were occurring when I graduated from nursing school in 1976. And here we are in 2024, and some of the same issues exist. So the question becomes, what do we do now? And what do you need to know? Thank you.
Thank you, Dr. Bankston. I'm looking forward to hearing all of the wisdom you're going to share with us tonight. Ashley Glass, she is the founder of Black Women Cultivating Change. How are you doing, Ms. Glass?
I'm doing very well. Thank you so much, Tropikana. So I'm the founder of Black Women Cultivating Change. We are a nonprofit here in Cincinnati, well, the Southwest region of Ohio. We focus on eliminating the stigma related to mental health and wellness in the Black community. So very passionate about mental and behavioral health. I'm actually a new nurse. I just graduated last spring. So, but I actually started my nursing school journey in 2005. So it took me this long to become a nurse. And we'll share a little bit more about my story too. But truly love the profession. I have the utmost respect for nurses, the utmost respect for the ladies who are on the call with me tonight. They have helped me along my journey, and I appreciate all of them. And I'm looking forward to this conversation. So thank you so much.
Absolutely. Deasa Dorsey, she, in addition to being a nurse, she does community work on diabetes as well. Hi, Deasa, how are you doing today? Am I saying it correctly?
Deasa.
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 Deasa. Okay. It's French.
Okay.
Go ahead, Nurse Dorsey. How are you? Share a little bit with us about yourself.
Yeah. So again, my name is Deasa Dorsey. I've been a nurse for, it's almost wild to say this, but it'll be 14 years in June. It feels like it hasn't been that long. I'm the founder of ICANN Health. Like you said, our initiative is currently helping people with prediabetes and diabetes type 2. And I'm also the visionary and co-founder of Black Nurse Network. I always have to pay homage to Dr. Bankston, who helped me start that organization. Our goal is to ensure that Black nursing students graduate from nursing programs. Like you said, we'll get into it and even the purpose of the documentary, but there's a lot of work to be done, specifically in nursing, and we're hoping that we shed light on some of those things.
Thank you so much. Jan-Michele. Vice Mayor Jan-Michele is
Hi.
first. Is that me?
I'm not sure why it's doing that. Okay, I might have to log off and come back on. I'm so sorry. How's everybody doing?
We're great, Vice Mayor. Welcome. We can hear you now. We had one last introduction, not least, and absolutely not a stranger to these town halls, Miss Felicia Beckham. How are you today?
I'm good. Good evening. Good to see you.
Good to see you as well. You want to share a little bit about yourself and your journey as well?
Absolutely. So I am a Cincinnati public school graduate. So I went to Hughes and they had a health profession, which exposed me to nursing and other health profession, gained an interest in nursing through that track. Went across the street and got accepted into University of Cincinnati College of Nursing field. And then also, so it's been, oh my goodness, graduated in 2008 from nursing school with my bachelor's and went back and got my master's in 2014. And through that, I've been an ER nurse, ICU nurse. I've been a geriatric nurse, then went back and now I'm in geriatrics too, when we talk about end of life and, just aging well. So I've seen it all, but the thing is that it's not a lot of us still. And we need to figure out how we could improve that just because, we need to see us when we go into the hospitals and other healthcare settings. So really excited about this conversation. Thank you for having me.
Thank you so much for joining us. And I'll turn the floor over to Vice Mayor Jan-Michele.
Hey, so good to see everybody. I'm excited about this topic and really excited about the movie that you guys have made. So I should ask Tropikana, are we ready to jump into questions?
I think it's time to jump into some of these questions.
Okay.
You want to start with question one, or would you like me to?
Well, you know what? I wanted to hear about breaking the silence. So this is a documentary about Black nurses, and from what I understand, Deasa and Ashley received a grant together to get funding for this documentary. So I just want to hear all about it. Can you all tell us about that?
Yes, go ahead, Ashley.
Okay, I'll just start with ArtsWave because they were one of our first funders. So we got some funding through the Black and Brown Artists Truth and Reconciliation Grant, which aligned perfectly with what we're doing in our documentary. We are sharing the stories of Black nurses so that people can understand the racism experienced both in the academic space as well as in the profession, but also some of the historical context too. A lot of times we don't learn our history, the impacts that Black nurses had on the profession. So we hope to inspire people and ultimately recruit as many Black nurses as we can with this film. But I'll let Deasa talk more about our sponsors, our other sponsors.
Yeah, you pretty much nailed it. We want to give voice to our Black nurses, the invaluable contributions, the resilience, the stories. A lot of times when we think about nursing, we think about one specifically white nurse, namely Florence Nightingale. But we were nurses way before that. And so we want to make sure that we, especially during Nurses Week, I'm appreciative, I'm grateful. I know we all are for those that have gone before us to pave the way for us to be here. And we want to make sure that we shed light on that. And in addition to our ArtsWave grant, we've had sponsorships, additional sponsors, BI3, Interact for Health, United Way, Icon Health, Children's Hospital, the Health Gap, Mercy Hospital, TriHealth, University of Cincinnati College of Nursing, and Mount St. Joe College of Nursing. So
wow,
major supporters behind us in this.
That's fantastic. You all are really impressive. It's hard getting funding for projects, and you really got a lot of that. So what made you want to actually do the film in the first place?
I'll go first, Ash. So for me personally, I work in higher ed in addition to some of the other things I do. And I had a meeting back in 2023 with some courageous Black nursing students, as well as with their dean and their associate dean of like inclusion and community impact. And I listened to their stories and their experiences, and they honestly were pretty heartbreaking. Listening to how they were, the minorities in the classes, and they were targets of racism and discrimination and bias, and just some other things that they were going through. And I'm like, this is not okay. Like, this can't end here. In addition to my own journey in nursing, being one of few, I know everybody on, all the nurses on this call know they were one of few in their classroom settings. And me being me, I'm like, why? What is going on? Like, this has been decades upon decades of this. Like, this something's not okay. And I can't hear these stories from these students, from our future nurses, and just let that rest there. And so and then, I've known Ashley for some time, and she shared some of her journey, and I'm like, what are we gonna do? Like, we got to do something. So that's kind of a little bit of how we got here.
And can I ask you all to share with us? Let's just get a little personal, if that's okay. Can you share what you're comfortable with sharing about your journey? You guys have touched on some things. You talked about racism, things you went through as being, the one and only, or, or one of the few. Can you, and I'm sure a lot of people out here are saying, yeah, same thing. They can definitely relate to that. But can you just, can we get a little bit personal? Just tell us a little bit about that.
Let me give because I think one of the things that I said in my introduction was that it saddens me that we're still talking about this, because I graduated from nursing school almost 50 years ago, and we're still talking about those things that occurred back then. I'll give you a couple of personal examples from the school that I went to. One, if you're familiar with what they call the clinical setting, in a clinical setting, the student is given their assignment, and usually you're given your assignment the night before. And then you go home and you look everything up, all the diagnoses and everything, and you set up a plan on what you're going to do with the patient the next day. I had a teacher. I was the only African American in my class. So I had a teacher who every week never had my assignment posted before clinical, that night before clinical. So that would mean that I would have to take all of my books with me, get there like really early, find her, ask her, and then try to get it together so that I could tell her what I'm going to do with my patient. I had to report that. I had my mother, I was 18. So I had my mother go and talk with the school to get that turned around. Fast forward, I become a nurse. So I'm now a registered nurse. And back then, nurses were all white. Okay, you've seen the pictures, all white, little caps on our heads. Okay, but unlike today, back then, there was usually only one RN on the floor. Everyone else were nurses' aides, etc. And they wore different colors. And sometimes a patient might ask for the nurse. That would be me.
That would
And
be you.
I would go into the room and the patient would say, well, I need a nurse.
Oh,
I need a nurse. And I'm like, I am the nurse, and having to say that over and over and over again. Fast forward a little bit, I leave the floor and I go to the emergency room, which I loved. I loved working in the trauma unit, and a patient comes in. We were really busy. It was a 3 to 11 shift, really busy time. And the guy comes in, he's complaining of chest pain. He's got his eyes closed, family's with him. He's going on and on about, how he's hurting and blah, blah, blah. I put him on the monitor. I can see that he's having EKG changes, having a heart attack. I need to start an IV. Go grab the stuff, get ready to start the IV. He opens his eyes and calls me the N-word and don't touch him.
no.
Yes. Okay. Now
Oh,
I'm trying to stay calm. Sir, you're having a heart attack. I need to start this IV because we need to give you some medication. He would not allow me to touch him. So there was a code going on in the other room. I went into the other room. I was the first and only Black nurse to ever work in the ER in my hometown. And I went in, got the white girl, let her come out start the IV. And I went in, hey, I like the trauma stuff anyway. So that was, fine with me, but it hurt so bad that would happen. Now I'm going to really fast forward. I'm going to fast forward to my time at the Drake Center. And now, of course, I'm not a nurse now, but I'm still in healthcare. And they're looking for the president of the hospital, right? And my secretary is white. And so they can't see me. I'm in my office, but I could hear them come up to ask. And she said, well, let me see if Dr. Bankston, I can see you now. And they walk in, and, big old office. They're looking around, and I put my hand out and say, I'm Dr. Bankston. So I guess the importance of all of this is that these are the kinds of things that happened then through time, and are continuing to happen, as Deasa just shared with the students that we met with.
Oh, I can just feel that hurt. I mean, you really were saving that man's life. I'm back to the man and the, having the heart attack. You were in the process of saving his life. And, and you went and got someone else, which, I mean, it's wonderful. I'm thinking, I wonder what, a lot of people would have said, well, forget you. And, I mean, you know what I mean? It's like you stayed professional and saved his life. And
I stayed, even though he was, he kept saying, and you all killed my brother, and so forth and so on. And I just can recall saying to him, I don't know your brother. Here's what I know. I know that you have heart changes, and I need to do something. And he just wasn't going to allow. It was going to make it worse. And so I went and got another nurse, and that was that.
And let me just say, I remember your office at Drake Hospital. My mom
was a big office.
You were so wonderful. I was so proud of you. And I remember walking into your office and like, wow, this is beautiful. And you deserved all of it. Because you've just been a role model for so many, and you've done so much. And so I feel so bad that, you had to go through all that hurt. I mean, that's horrible. And so, I'm sorry, go ahead, Karen.
I was just going to say, I'd be on here all night. I got lots of stories, and that's another part of the sad part, but I want my babies to say something.
Wow. And you're saying 50 years later, we've got this documentary about things that have happened recently, right? So
yeah, here's the good news, though. Here's the good news, because I think, and I've said this to my white colleagues, this is not to minimize anything that anyone else has done. But what it's doing is bringing to light what the white nurses already knew. And that has been demonstrated by, if you haven't seen it, the American Nurses Association put out in 2022 what is called their racial reckoning statement. So the American Nurses Association, all the way through the 1950s, did not allow Black nurses to be members, which is how the National Black Nurses Association got started, because there wasn't a professional organization. Finally, after all the years and all the discussion and things that everyone has said, the ANA, which is the Professional Nursing Organization for nurses, put out a racial reckoning statement and established a commission to begin working on a national level as it relates to racism in nursing.
Wow. Okay. Ooh.
How difficult is it to put that hurt to the side to still care for your patients? That's such an honorable charge, to have to care and save lives the way that you guys have committed to doing that, but still being human. How difficult is it to put that hurt or that disappointment or that heartbreak to the side when you are dealing with a person who lashes out at you like that? How did you handle that? To just walk away?
It is difficult. It is difficult why I'm still talking about it at 50 years. I mean, it is absolutely difficult. And I will say this, Tropikana, to this question. And again, I know Deasa got something to say, because I can see it on her face. But I will say this. I love Renee, when Renee came up with "We Must Save Us." When she came out with that for the Center for Closing the Health Gap, we're in that same position right now as it relates to nursing in the profession and providing care to patients. And the reason why I say that is that Black nurses who were perhaps of my generation, who were able to take that pain and hurt and put it all inside and keep going, this new generation is saying, I ain't doing that. Okay, I'm not doing that. And the challenge, as we've talked about in some discussions, the challenge is if we begin to say, we as Black people, Black nurses, begin to say we're not going to do it, and we know factually by the statistics and the data that Black people respond better with nurses and doctors who look like them, then who's going to take care of us if all of us decide we're not going to do it anymore? So yes, I think, I'm of a generation, because I'm a baby boomer, so I'm of a generation where we like sucked it up and said, you know what, you ain't stopping me, I'm gonna do what I'm gonna do. And I would keep on going. But
Right.
what I think we're seeing is a change. And that's why this work that Deasa and Ashley has become so important, because we do have to save us. We do have to save us, because the facts are that racism does exist in our society. People don't take their hearts and heads off because they become a patient. They're still whoever they were. They don't take their hearts and heads off because they go to school to be a nurse. They're still who they were. So we have to just recognize that and come up with ways to be able to support one another, create safe spaces so that we can provide care and services to the people who deserve it from us.
Thank you for saying that. I asked that question because you're absolutely right. I agree with you on everything you said. That we do have to take a lesson of that perseverance. And that's the reason I asked, how did you do that? Because we do have to still deal with racism, and in dealing with it, there's a level of perseverance and patience that baby boomers displayed that we just don't have. And maybe it's a little bit of arrogance or a little bit of entitlement that we didn't think that we needed to. So thank you for sharing that. I know you said, Deasa, you had something that you wanted to share.
Yes, she
Okay.
does.
I didn't want to step over.
No, nothing in particular. Go ahead.
Well,
Like,
anyone else, does anyone else want to, Ashley, Felicia, do you guys want to share anything from your personal journey?
I'll definitely share. So fast forward to being a nurse practitioner. So kind of went through being a nurse, and now working in a clinical setting as a nurse practitioner. Of course, you have nurse practitioner students, and some of them are white. So you would go in with in a room, and again, you kind of demonstrate how you are providing care as a nurse practitioner. So I would go in, tell someone their results or recommendations, and the white patient would say, "So, what do you think?" And they would point to the NP student, and they were like, "Oh, I'm just an NP student." And they were like, "No, but I still want to know what you think. What do you think?" And they're like, "Okay, well, she just told you." They was like, "No, I want to hear it from you, and I want your recommendations." And although, so we're in a setting, I'm supposed to be, the lead. I am an NP that is definitely gone through school, competent in what I need to do, delivering care. And then I'm also trying to be, a great advocate for the NP student. And those are, not, they're frequent. There are frequent conversations. There are assumptions that I walk into the room with a white NP student, and they always assume that they are the NP and I am the student, or I am, a nurse. So for me, it is, compartmentalizing all your feelings in that moment, on top of making sure you prioritize the professionalism and the person that you are, and addressing that outside of the room. But it's unfortunate just because I've gotten so used to strongly advocating for myself in that situation, and really directing and being direct about their behavior. So therefore we can change the outcomes, and also just making sure they know to be an advocate for themselves too. So it is something that is unfortunately the norm. When I walk in the room, even with the white coat, "Oh, you're an aide?" It's like, I have on a white coat. And
Right.
it still doesn't resonate. And also for me, it's just like, why can't you see beyond that? Why couldn't I be something beyond an A? Now, I was an A before. Nothing wrong with everyone, deserves that. But like, I walk in a room with a white coat, and I'm still explaining myself to this day. I've been an NP for almost 10 years. And I'm still
Wow.
explaining that I am not an aide. I am not from the kitchen. I am not the janitor. I am a nurse practitioner. So it is tiring. It is heavy, on top of everything else that you do. But thankful for this documentary for giving us voice to our experiences. So therefore, we could definitely be better advocates for ourselves in the beginning.
Absolutely. And, that's why I really appreciate you sharing that. Because I think, another thing that happens is, with just racism in general and, any profession, we wonder, are we being oversensitive? Is this really happening to us? Maybe I'm just misinterpreting, and you feel a little crazy. Like maybe I'm being paranoid. And so it's good to, we've got to share these stories and talk about it so everybody can say, yeah, that happens to me too. And then I like your advice on how do you deal with that? How do you, you're like, you've got to advocate. And so I think that's really, really important to share that. So thank you for that.
Wow. Now, I would also like to ask, uh, if what is there a need for more Black nurses? And if so, can you tell us why? Anybody
Yeah,
want?
here's I said a little bit ago that the research is clear. Okay, so let me just go back a little bit. The nursing research as it relates to patient outcome, meaning the nurse's impact or influence on the patient's outcome, started being done in the 80s, right, at a really big pace. And what the data showed at that time, and this is very interesting, what the data showed at that time was that a registered nurse should have a baccalaureate degree, because prior to that, registered nurses went to diploma programs in the hospitals or they had associate degrees. And the research showed that nurses who had baccalaureate degrees have a more liberal-based educational knowledge and subsequently are able to critically think at a bigger level, right? And they showed all through the 80s into the 90s, they talked about that and they were going to change who could be a nurse and all that, and that never happened. But the issues related to health outcomes remained. Then in the late 90s, and a book came out by the Institute of Medicine in the late 90s at the turn of the century that talked about the quality of care and the racism that existed in healthcare delivery and the disparities that existed. And that's when we first started hearing a lot about healthcare disparities. And what we have found since that time, since that Institute of Medicine report came out, was that the disparities between, in particular, white individuals and Black individuals was big. The gap was big, whether we're talking about blood pressure, diabetes, kidney disease, heart failure, cancer, you name it, there's this huge gap. Black people are doing worse. More research was then done on a sociological and a psychological perspective at the turn of the century that showed that individuals did better when there was a cultural relationship between the provider and the patient. Lots of different reasons that could be true, and there are lots of reasons why it is true. But they showed that that was what was going on, that we needed some people to become culturally competent, as we began to call it. So you heard a lot about cultural competency in the care area. How do we get everyone to appreciate the differences that exist among people so that we can develop initiatives that allow folks to be able to get better. So having said that, what better way to get people who are culturally competent than to get some people who look like the people who are needing the care, right? And so how do we begin to get individuals to be interested, and this certainly is for nursing, but it's for all the healthcare professions, to begin to go into the field so that we can save us. Again, I love when Renee came up with that. We got to save us. We got to save us. And how do we begin to do that? And that's not to say, it's not to say that others cannot establish a cultural sensitivity and cultural humility in order to be able to provide care. What we know is that some of us come with that. Although I said some. Now y'all heard that. I said some. I'm looking at Deasa again. All of us don't come with it, okay? We don't. All of us in this new era don't come with it, but some of us do, and that would, I think, be helpful in closing the gap. So it is supported by research. This is not research done at the highest level in our country. This is not something that we just think we need. This is something we really do truly need.
But I will also add that I just saw statistics that nurses make 960 decisions each shift. 960 decisions each shift. And also the decision making is influenced by experience, exposure, what you're taught, your culture, all of these things. So imagine if you had someone that didn't look like you who, had a bias. And the decision for her to treat you the way you deserve is basically in her hands. I can give you a scenario. I was working in one of the local hospitals, and a lady came in with a gunshot wound, and she was only given Tylenol. And and also for me, the advocacy of a nurse, the decision to advocate is crucial. So what do you do for the care of the patient that they deserve? The decision is to advocate, and some will not. Some will not.
Even though that advocacy that she's speaking to is a part of the practice of nursing, it's written in the Ohio Revised Code that nurses advocate for their patients. That's it's not something that people like to think they might do. They really have a responsibility to do.
And some people
Oh,
don't.
that's interesting. Yeah.
Yeah, some
And
people don't.
Yeah, I was going to say that reminds me, during COVID, we kept hearing a lot about misinformation that Black people sustain pain more, like we don't need pain meds, or, that kept coming up during COVID. So that was interesting when you said they just gave her Tylenol. That's a flashback to that.
And I was thinking on the same thing too, Vice Mayor, when they talk about our predisposed disparities that are for us, it would just maybe be better to have that care from somebody who looks like me. So I don't feel like maybe you're lying to me about that statistic. That was a really great point. I just wanted to jump in on that.
And I would like,
I was going to piggyback off of what Tropikana is saying. We learn so much in the school setting. We learn so much about the racial disparities in health, but we're not learning about the racist policies and practices that help create those disparities. It's not that we're Black and then so we have hypertension more than other people. Let's talk about all the other things that got us to this point, And I think that's another thing that we want to kind of expose with this film is like, there's so many built-in things to it, and it's literally killing us. I mean, the fact that Black women aren't being heard, or Black pregnant people aren't being heard when they go into to give birth and they don't make it. That's real, and it's disproportionate to us. So it's literally killing us. Racism is literally killing us in the health field.
Wow.
Yeah, and I wanted to share because I literally just got out of the schooling. And so for me, it was shocking because my background is actually public health. So I started out at UC in 2005 in pre-nursing. I did not get into the nursing college and ended up in public health. And so with public health, we learned about health disparities and all of that. And after graduating, I worked in a lot of healthcare systems. And I just didn't understand why there was this gap between clinical and public health and population health and all of that. And so going through the schooling, I was shocked that we don't really learn about health disparities. You don't learn about the racism in healthcare. We have one class on community health. We didn't have, in my program anyway, we didn't have any clinicals in community health. So we did like a project in the class. And so it's not very, I feel like we have a lot of opportunity to incorporate a lot more on racism in healthcare. Also, the advocacy piece. We were never taught in the schooling either about how you can advocate as a nurse, how you can go, to the State House and advocate, even with the Ohio Nurses Association, or, that could even be an assignment too. Let's see how students can come together and what issues can you all advocate for to change policy in the hospital setting, in the community, all of that. So I feel like there's a lot of opportunity to incorporate more of that public health into nursing because it's so important. I love both professions. Of course, I've always wanted to be a nurse. I didn't foresee the public health part, but now I'm seeing how everything is coming together to really advocate for equitable care for everyone. So.
And
I
the
love that, Ashley. I was going to say, growing up, like I always, you always hear about, how Black people have, we have more diabetes, more cancer, more hypertension. But the idea was it's because of things we're doing. And, the Center for Closing the Health Gap, I've got to thank them for that because they've really been educating us. And you have too with Black women, cultivating change about how it's really systemic. I mean, there's systems out there in place that have created these issues for us, and we didn't know that. Right? We thought, well, it must be my fault, like I'm eating the wrong things, or I'm not making good choices, and that's why I've got cancer.
Well,
So
and with them not taking into consideration the environment, all right? Because when we talk about you're not eating the right things, where you can only eat what's available to you. So if you live in an
processed food,
area
right?
where there's no fresh food or fresh meat and unprocessed
Right.
things for you to eat, what do you think is going to happen? If you live
Right.
in housing where there's lead paint and bad water because of the pipes, and what do you think is going to happen? And so
Right.
when she speaks about public health, that intersection between public health and the delivery of care is so vitally important, because we need to understand so we can go and get the laws changed that have created these systems that have disproportionately impacted people that look like us. I mean, it is the social determinants of health, as we call them in our field, really are so vitally important for systems, the healthcare delivery systems, to understand in order to really begin to close that gap. We have
Right.
got to pay attention to housing and education and food and criminal, all of it, violence, all of that. All of those things have
Right.
to be included.
Right. And I just saw, Renee, I think, is the one who sent this article to me about how food insecurity increases violence. And, I didn't think about, we do talk about people being hangry, but just hadn't really thought about that as a real thing. Like that's a real thing, so, and it actually makes a lot of sense. But, I'm amazed, given all of this, that nursing schools and med schools aren't talking about these disparities. They're not talking about the systems in place. Well, what's going on there?
Well, they are talking about it, okay? And there are textbooks that are, in fact, I just wrote a chapter for a public health, community health textbook.
Oh,
And
good.
I wrote the health disparities chapter. They are talking about it, but again, just as there aren't individuals like us who are providing care, there aren't a lot of individuals like us that are teaching either. All right. And so if you as the instructor, the professor, maybe don't have a passion about this, the nursing students have to have community in order to take state boards. So they've got to have the community nursing. But if you're not really passionate about it, how in depth are your assignments going to be in order for the students to even begin to critically think about it? So part of the challenge is that we also don't have enough professors that look like us to challenge the norm, because remember I said the American Nurse Association and the American Association of Colleges of Nursing, they're just now talking about racism in the field. They're just now talking about it and just now coming together to say, whoa, my God, what are we going to do? So there's a lot of work now that has to be done to begin to get individuals excited enough to do what Tropikana, what she mentioned earlier, and that is persist through the challenge. Deasa's over in academia now. She knows the kind of stuff she has to raise her hand and say, can I ask this question? What about, you've got to have somebody in the room that's willing to advocate for that. And I think that, yes, they're talking about it. They talk about it in all. I've done talks all over the country in colleges of nursing and med schools. and they are talking about it, but there's not the passion. There's not the passion for it.
And to take it a step further, to your point, and being in academia, just in 2024, true example, the same people that are teaching cultural competency classes and, you know, cultural awareness and all the things, the same people have had in their what is it called? The what you their what you get before the class
The
starts.
syllabus. The
Syllabus.
syllabus.
Thank you. Sorry, I had a whole brain. All right, so in the syllabus, it says there was a statement that said wigs not allowed. I love Black women's faces after I said, because that's exactly
That is what it said.
it said wigs not allowed. And I'm like, hold on.
What?
2024, and we're teaching, like Dr. Beckham said, we're teaching cultural not we, but it's being
Right.
taught in some fashion.
Right.
And wigs not allowed. And so of course I challenge that. Absolutely. I needed to understand, because you can wear wigs for multiple reasons, but you know, I didn't understand why that was even validated. But yeah, people with cancer wear wigs, or
Right.
alopecia. There's many reasons, but who are you talking about here? And why did this make it to your why did this make it to your syllabus?
Yeah.
Making a change, but because there's people that can talk about it, but they don't live it, or they don't understand it. And like Dr. Banks said, it's no passion, it's lack of passion behind it, because it's just like everybody else in 2020 when they were making statements during the whole George Floyd thing and DEI, and now you see laws trying to the issue. What is the state issue that they're trying to remove DEI?
As
Right.
Senate Bill
Right.
83.
Senate Bill 83. So it's
Yeah.
like, we talking, they're talking, but you know, what is the impact? What is really actually happening?
Oh my goodness.
Wow.
And
And so,
and another thing, you know, all of these stories that you hear from us, if you were to ask any Black nurse what their experiences was in school, they would share similar sentiments. And that's why we created the documentary, and why we wanted to come on today, is we're all going through these things. And how you had mentioned, am I going crazy? I asked myself that I don't know how many times when I was on the road to becoming a nurse. Am I really smart enough for this? Because when you're in those classrooms and you're getting those microaggressions and being treated not equally to your peers, you really do start to question, like, am I really supposed to be doing this? And so for me, just to share the personal, like I share this in the documentary, I don't want anyone else to experience what I had to experience just trying to become a nurse. I don't want us to have to keep on going through this. It's not fair. And there should be some accountability. I feel like there is not a lot of accountability in an academic space for Black students to advocate for themselves. If stuff happens, it's really, they're quieted. You really, if you do try to reach out to, let's say the dean or some people who are in the provost, whoever it is, it's you're shut down. So you're just left with these feelings of anxiety. It took me a year to take my NCLEX after I graduated because of an experience I had in school. And I had test anxiety and all that from what I experienced in school. So there's a lot that goes on in nursing school. And I just think that people need to be held accountable for how they're treating people, which then we're seeing nurses leave the profession because, you know, you're experiencing this in the academic space and then it transfers into the professional space. And so why would anyone want to stick around for that? You know, you go into it with a heart of passion. You just want to help others and take care of others, but you should not have to defend yourself from all of the racist behaviors and systemic things and microaggressions and all that just to do your job. So I just wanted to say that too.
well, so Ashley, where does one go with that? Like when you're in class and you know you're not being treated well and it's discouraging, you know, where can you take that to really keep going? I mean, somehow you kept going.
I will defer to my other panelists, to especially the ones, Dr. Bankston and Deasa, who are working in schools. But honestly, like I said, I was quieted and I just had to deal with it and just persevere. And you know, we share it with amongst each other, but again, no one is being held accountable. And so that's why it keeps on happening. Even if you report a professor, or anything like that, it goes nowhere. It literally goes nowhere. So I'm hoping when we do our community showing specifically that we get more allies to really truly help these students when they're experiencing these different things, because we don't have anybody holding anybody accountable, and it's by the grace of God that we all made it through. But
Heck yeah,
yeah.
yeah.
With
Now,
each other, like we needed each other. If it wasn't for all of y'all on top of everybody else, like we could not have done it without each other. And that's the beauty about community. But the unfortunate part is that we needed each other to get us through.
you know, I want to
Yeah,
just say
it's a
thank you.
hard profession. Oh, I'm sorry, Tropicana, go ahead.
No, just piggybacking off what they said, I just want to tell you guys thank you, because your experiences were not in vain. They're for the general public, of me, a patient that's gonna come to see y'all. But my little sister is in nursing school right now. I cannot wait to send her this link so that she can, some of the things that you guys are sharing are some of the things that she has, called in the middle of the night crying about and studying for finals, and the same microaggressions that you ladies are sharing. I'm so excited. I wish she was on here tonight to share this with her, because it's the young nurses coming behind you guys that you guys are setting that tempo for. And I'm so thankful that you guys are having a conversation, so that even if there's not a resolve, they know that they're not alone. Because that's the hardest part of it all, is thinking it is only you that's going through that experience. And so just thank you for taking the time to utilize your platform to say, hey, yes, it's racism, but you can survive, and we're still surviving.
Racism is real, right?
It's
Racism
real.
is real. You're
Whether we
not
say it out loud or
imagining
not.
it.
Right.
Yeah.
Now, Vice Mayor, they've spoken about racism from patients and from nursing school, but do you guys have experiences with your counterparts as well, other nurses and
Yes,
you work with?
yes, yes. Yeah,
Uh-oh.
that's why I said we must save us. And it's both sides, okay? It's both sides. So, when I went to nursing school, where there were very few Black registered nurses, but a lot of the STNAs and LPNs were Black. Well, they didn't like me. Well, you think you better than us. Okay, you all, come on, y'all sister girls. Y'all know that happens in our community. You think you better than us. No, I went to school. I'm an RN. I don't think I'm better than anybody. That's just, so you had that. Then on the other side, you have the white nurses who will say, well, you don't belong here. You just got here because of affirmative action.
Mm-hmm.
Oh, I passed the test. I passed the exam. I can belong here. I can be here just as much as you. So we have it on both ends. And I think that's why I love we have to save us. I think we have to also recognize that's a reality, that we have to deal with these challenges that our society has kind of put before us in order to serve the way that this profession was designed to serve. It's on both sides. I tease my ladies here all the time about, did you see what was on Black Nurses Rock last night? I mean, what is wrong with y'all people? Because they will say things about patients that look like us that I'm like, if one of them, if I was a patient and one of them came up at me, I would kick them out of the room, just like that white person kicked me out of their room. So I think we've got both kinds of things. How are we able to be our authentic selves in an environment that is culturally in chaos? How do we begin to do that? And I applaud Ashley and Deasa for coming up with this, because I think we've got to be open about that. We've got to be open and talk about the bullying that goes on. Bullying
Yes.
already goes on in nursing. It was, they used to have a little saying, I don't know, ladies, do they still say that? Nurses eat their young. Used to be, if you were an older nurse and you got a younger nurse, well, you're going to give her a hard time because the person that you had given you a hard time, so you're going to keep doing that. Well, that bullying has
Sounds like
gotten
hazing.
worse. Yes, like hazing. The
Yeah.
bullying has gotten worse, so bad that those that do occupational health nursing are now trying to figure out how do they create environments where the bullying will stop. Because that not only is it that you have patients that might smack you, but you also have colleagues that might say something to you that's not going to be supportive of your being able to work.
You know, that's that just reminds me about law school. I just have to say this real fast about affirmative action. So my first day of law school, I got in so excited, you know, happy to meet everybody, sitting up in class. This white guy was sitting next to me. He turned to me and said, you know, you're just here because of affirmative action. And I thought, well, you're right, because I worked hard. I made good grades. I graduated with honors. I did real well on my LSAT. But I wouldn't be here if it weren't for affirmative action, because that's what's happening in this country.
That's a fact. That's right.
Right. Lots of qualified people don't get where they need to be without affirmative action.
That's
So,
exactly right. That's exactly
yeah.
right.
But
And
you
to
know, the other thing you said to me that really resonates is when you talked about our own colleagues, our own people who look like us being the ones pulling us down. We got to watch that. That's, you know, to me, that's like a colonized mentality, that we feel like we have to pull each other down and make each other feel less than. They should be looking at you and going, we're proud of you, Dr. Bankston. You know, you've achieved a lot, and I want to achieve what you've achieved, as opposed to you think you're better than we are.
Mhm.
You know, that's a colonized mentality. We've got to get out of that self-hatred.
We simply could just say, hi, can you teach me how to get there? Or can you give me some advice? Or
Right.
just point me in the right direction.
Yeah, that's right. We got to lift each other up. Yeah.
And to your point about just, you know, the colleagues, the thing that the people that don't look like us, it just as a Black woman in general, you know how it is when you step into a room, you're automatically reminded that you're Black. And like any profession, that is exactly how it is. We can't just show up like I think Dr. Mink said, authentic, who we are. We're constantly being questioned about our education. I know one of Felicia's examples is, you know, like she talked about what's her credential basically.
Mhm.
Constantly questioned, you know, I've been asked like, did you go to school for two, as if this makes the biggest difference, but did you go to school for 2 years, or are you a 4-year nerd? Like, where does your education status lie? Your intelligence, how you talk, how we interact, our body language, our tone. If you're too loud, if you ask too many questions, if you're aggressive, if you're an angry Black woman, like all the things, like
Oh
we deal
man,
with
yeah.
all of that from our colleagues, but even from our patients. Like, if I have a Black patient, I know how we get excited, or we get, you know, when we are scared, how we might respond, or when, you know what I mean? So just being able to understand. But to a white nurse, if somebody gets a little loud, or, you know, family gets a little riled up because they're excited about something, oh, they're being, you know, combative, or they're, you know, whatever the case, we get labeled all these things. And so yeah, absolutely. Like, you just can't just show up all the time. And I think that's unfortunate. And I want us to begin to have environments and in nursing and health period, that we can just show up and be without being asked, is your hair real? Oh, it was down this long yesterday. It's short
Right.
today. Or being passed up on opportunities just because we're Black, and we see our white colleague get promoted with the same or less credentials as us. How is that?
Right.
I've seen that too many times. All of a sudden they're a manager. Like, how did that work? So absolutely, from our colleagues as well.
Yeah, and that's back to training the aides, and you know, the patients are asking the aides for their opinion. If Felicia's like, I'm the one that trained that person, you know, you're asking somebody, you know, it doesn't make any, just makes no sense. It makes no sense, and it's really hurtful, and I think it really wears people down. So it really wears us down. I want to hear more about how we can see your movie, um, Breaking the Silence. You know, I know there's a screening tomorrow, which is Tuesday. I hear this one on Friday. Tell us all about that. Okay,
Oh,
Ashley, I think
sorry.
Jace is
Yeah.
pointing at you.
So tomorrow we have a private screening for our sponsors and supporters. So it will be, I guess I can share the information, but it'll be at Kenwood Theater at 11:30. So we will plan on showing the documentary, but also having a panel discussion after. So tomorrow's is at 11:30 at Kenwood Theater, but Fridays is at the Cincinnati Museum Center, and it starts at 6. So, but both you'll be able to hear from some of the people in the documentary, and if you have additional questions, please come with questions because we will be there. We can elaborate more on our stories and our experiences, but we truly hope people enjoy it. And then Deasa, I'll kick it to you to talk about after.
Yeah, because I'd like to hear where is it going? Because to me, it sounds like it's something that needs to be shown in our schools, in our med schools, our nursing schools. You know, tell me about that, Deasa.
Yeah, that is definitely the hope, the goal. We will be offering private screenings as well. So if there is like a smaller organization or a larger organization that just wants their, or their participants to be able to come, we certainly will offer private screenings. We've got a couple already in the works, hospital organizations that are interested. Again, Friday is our public one, and because the tickets, we didn't sell tickets, we just like placeholders. They went so fast before we could even really promote. Like we hadn't even promoted anything yet, and they
Wow.
had 300, and they were gone like in a couple days.
Yeah.
So that tells us, one, that this conversation and these things need to be talked about and had. But and the
Right.
support has just been so like amazing and overwhelming. But we're also, because of that, we're also probably going to offer another community screening because we want people to be able to access this. This is something that is going to really benefit all of us at the end of the day, whether you're the patient, you're the mental health therapist, you are the nurse, the MP, all over. Like it helps all of us. Also in July, we will be doing, it's July, right, Ashley? We'll have another screening opportunity in conjunction with Arts Wave because it's our showcase. So we'll have some of that. So we'll get all that information out there. You can follow us on Facebook. You can follow us individually on Instagram, and you can email us if you were interested in a private screening at bnursedoc23@gmail.com.
Okay, bnurse.23@gmail.com. Okay, good to know.
Put
Now,
that in.
Vice Mayor, before we do closing statements, we had a question from the chat. If anybody would like to answer it, and they would like to ask, can you explain the alphabet soup of nursing, RN versus LPN versus RNA?
I saw that. I'll take a stab at it. Okay. And I love talking about this because again, this is something that we've been talking about for a long time. So in the United States, because this is only for the United States, it's not in other countries. For the United States, the RN, the registered nurse, is considered, and this is the part that I'm getting ready to say makes people angry. This is considered the professional nurse. But in the United States, unfortunately, you can become a registered nurse more than one way. So you can have an associate degree, you can have there are a couple of diploma programs that are open, and then the baccalaureate degree. So for a registered nurse, there are 3 educational pathways to become a registered nurse, but they all take the same NCLEX or state licensing exam. Now, the difference between the associate degree nurse and the baccalaureate degree nurse is really only 1 semester of classes. It's the baccalaureate degree nurse is given more in-depth information related to community and public health nursing, what we were just talking about. That's the difference. And so when you take the exam, you don't see that on the exam because associate degree nurses don't get that level of education. The licensed practical nurse or the licensed vocational nurse is a nurse. I mean, people say, I'm a nurse too. Yes, you are. But that nurse cannot assess. Registered nurses can get to everything except diagnosing, which unless you become like Felicia, who's an advanced practice nurse. So the licensed vocational nurse does not do assessing. They do observation and then report to the registered nurse what's going on. That's how that process works. We don't have enough time to go into all the details, but that's the major difference. In most instances now, a licensed practical nurse can also give meds, but they have to take a special pharmaceutical course in order to do that. They don't automatically get to do that. The STNA is a state tested nursing aide. Those individuals do tasks that are assigned to them by either the registered nurse or the licensed practical nurse. Same for the CNA. In some organizations, it's called certified nurse's aide, and in some organizations, it's called patient care assistant. Very similar. Usually they get a training and they get a certificate showing that they've accomplished certain tasks that give them some competencies to do that. Then there's the medical assistant, the MA. The MA usually has at somewhere between 18, 12 and 18 months of education. They also get a certificate. You find them in your physician's offices. Under the physician's license, a medical assistant will sometimes look like a nurse because people think that they're nurses in their doctor's office, and most times they are not. They're medical assistants. But under the physician's license, they're able to take vital signs, give meds, even give injections. They might give you your flu shot, but that can only happen under the physician's license. The advanced practice nurse, like Felicia, has a medical, has a master's degree in the United States, has a master's degree and a certification that tells you what their specialty is. In most instances, in most states, the advanced practice nurse is like an eighth of an inch shy of doing all the things that physicians do. I know physicians don't like to hear that, but it is what it is. And so they're able to diagnose and treat. They have a collaborating agreement with physicians, but they pretty much work on their own.
Thank you, Dr. Bankston. You are wonderful. You know what? We are just about out of time. Does anybody want to 30 seconds? Just give us your final comments, something that you really want everyone to take away. So let's just start. I'm just looking at my screen. Dr. Bankston, you're up first.
Oh, I want people to realize that they have the right, the nurses, they have a right to advocate for themselves as it relates to their environment, their work environment, and to the patients. You have the right to ask questions related to your care and ensure that the person that's providing care to you is competent.
All right, Ashley Glass.
My lasting statement is we need more Black nurses. We need you. If you are thinking about becoming a nurse, please, we want you to become a nurse. We want to be there to support you along the way. And we're here to advocate for a more equitable process so that we can get as many Black nurses into the profession as we possibly can. Thank you.
Fantastic. Deasa Dorsey.
I would actually challenge nursing colleges and hospital systems to start to review their demographics. What do your nurses look like? How are your nursing students doing? How are we getting more Black faculty and staff? What is the mental health of your Black students and your Black nurses? What's your board makeup look like and your representation? And just those kind of questions. Start really digging in so that change could be made.
All right. Felicia Beckham.
I would just challenge everyone to really understand, to humanize the nursing profession, but also humanize the patients. Humanize the patients for them to understand, to realize that they deserve empathy and they deserve the higher level of care like everyone else. Everyone has a story, and everyone's voices needs to be elevated and to be heard. So in order for everyone to really accomplish all improving healthcare outcomes, we really need to take off and humanize everyone, so everyone deserves better care for everyone.
Absolutely.
Right.
Thank you so much, Nurse Beckham. Ladies, thank you for all of the information that you shared. I cannot wait to share this with my sister, and I'm sure there are others that are feeling the same way. As we are wrapping up and out of time, let's bring on the CEO for the Center for Closing the Health Gap, Renee Mahaffey-Harris.
Well, first of all, I wish we had more time, but that means we need to do this again.
Yes.
When we think about the fact that women go into hospitals and are not listened to by nurses because there's not enough nurses that look like you and that are representative of the incredible knowledge and capacities that you have, we got to fix that. And then we got to fix it from every level, be it from the academic level to, really encouraging and promoting better pipeline initiatives and programs at a high school, middle school, elementary level to really make our young people, men and women, aware of nursing as a profession. I think each of you, Dr. Bankston, Deasa, Ashley, Felicia, and of course our moderators, Vice Mayor Kearney and Tropikana, this conversation should not stop because it's Nurses Month or Nurses Week. It should continue. And it only continues by your openness and willingness to share what you see, what you experience, so that patients can start talking about what they experience, and that's how you begin to push and move on a system. So I commend all of you. I commend Ashley and Deasa for the documentary, breaking the silence, opening the conversation, and telling the truth, and letting and doing it in a setting in a way that it protects you too, right? But it protects all nursing professionals, that what they're living through is now going to be heard. So
Right.
congratulate all of you for all that you do for our community. And I thank you for being here tonight. And we must say this.